Hello and welcome to a very special live broadcast with MedStar Health. My name is Michelle Carter, and today we're diving into the incredible impact that philanthropy is having on gastroenterology at MedStar Georgetown University Hospital. I'm joined today by Dr. Nadim Haddad, Physician Executive Director and Regional Chief of Gastroenterology at MedStar Georgetown University Hospital, and Jeff Ferrill, whose journey through GI care is a powerful testament to the importance of donor support. Before we get into the discussion today, we want to thank you for tuning in. Give us a like to let us know that you're here and watching. Share this broadcast with your friends. And if you have any questions along the way, feel free to share those in the comments below. We'll take some time to answer those as well. So let's take some time to meet our guests first before we dive into the questions. Starting with Dr. Haddad, will you tell our viewers a little bit about yourself?
Good afternoon, Michelle, and good afternoon for our guests who are joining our live stream. I am Nadim Haddad. I am a GI physician and the Executive Physician Director for GI Services at MedStar Georgetown University Hospital and MedStar System-wide. I have the privilege of leading a team of clinicians, experts in the field of GI, and have managed to establish first-class clinical services based at the MedStar Georgetown University Hospital and well distributed across the system. And appreciate the opportunity to be on this broadcast and be able to share more exciting news about our department.
Awesome. Thank you so much, Dr. Haddad. We appreciate you taking the time to be here with us.
My pleasure.
Thanks. Now we want to turn to Jeff. Could you introduce yourself before we get into the questions?
Hello, my name is Jeff Ferrill, and I am a longtime patient of the GI department and excited to be here and talk about my experience.
Well, thank you so much for taking the time to be with us as well. Let's start with Dr. Haddad, talking about the big picture. Can you share the overall vision for the gastroenterology program at MedStar Georgetown?
Of course, let me give you some background. The GI division at MedStar Georgetown has been in existence for over 40, 50 years. It's well established as a hub for the GI, for GI care. It's recognized as a referral center, not just GI, but for the complex GI care that's needed. In addition to providing GI care to our patients, we are also known for being an educational and training center. Over the years, we have managed to educate and train some of the leading experts, not just locally, but in the nation in GI, and I happen to be one of them. In addition to the care and GI teaching and training, we also focus on research and development. We need to keep up with the advancement in healthcare, especially in GI. So much has developed over the last 20, 30 years. And if we don't keep up with it and be able to provide the most up-to-date clinical care, therapies, and diagnostics to our patients, we will not be doing them service. So over the years, our division has grown significantly and in different dimensions, not just in clinical areas, in volume, but our facilities have been a limiting factor. And it has become limiting that we can't really provide provide the care for our patients and in a timely fashion. So patients, when they're sick, and especially with serious diseases, they come with fear, full of emotions, and they're really scared. And you really need to provide not just the excellent care or the proper care, but in an environment that is reassuring. So, and this is really our priority, and we've been working with leadership and our philanthropy team and some of our grateful patients in moving forward with a GI expansion project. Uh, we want not just to have a nicer building, we really want to transform the care that we are providing. And we want our patients to feel the reassurance, to be comfortable when they come and see us. So we can, I'm happy to talk a little more about the project down the road.
Thank you. Thank you for sharing that background. Um, why is it so important to continue investing and expanding this program right now?
Yeah. Well, it's just like anything in medicine and life in general. Things are evolving. So many new treatments, so many new devices, so many new technologies. AI, for instance, is very important that we keep up with it. And to keep up with it, you got to keep investing, not to underplay research and development, to always come up with newer, better treatment options, diagnostic options for our patients. So we can do more with less. So we're instead of bigger operations now, we can do more and more with endoscopic techniques. Patients, instead of staying in the hospitals for a few days after a procedure, now it can be done on outpatient basis because we can do it more efficiently without doing it through the scope, without any cutting or more involved interventions.
That's fantastic to hear, especially from a patient perspective, that things are getting even better in terms of the form of treatments that are available, minimally invasive techniques. That's really great to hear. Could you share how has the GI program evolved over the past 35 years?
Of course, we have grown in size. I remember 25 years ago when I came back as a faculty member, we were about five, I remember, and that was back in 2000. Fast forward, now Georgetown itself, Georgetown University Hospital GI department is, we have about 15 faculty members and a total of 30 providers. So you do the math, we're, I don't know, 600-700 times bigger. Our volumes have expanded, have quadrupled since. The types of techniques or the types of procedures we provide have also grown wider, more options, and our research and development has also kept up. And we're known for the complex care that is managed here. We are known for our expertise in GI disorders like pancreatic malignancies, pancreatic cysts, pancreatic tumors, foregut surgery, foregut endoscopic techniques, inflammatory bowel disease, genetic disorders. So these are just to name a few centers of excellence that we are well recognized for. And that's a testament to the clinical expertise that we have, that we attracted and we retained and we supported with research and development along the way. At the same time, to keep up, you need better facilities, better equipments, newer equipments, and so forth.
That leads me to my next question. What sets MedStar Georgetown's GI program apart on a national and even international level?
Yeah. Over the years, we have been well recognized for the education, training, research, and development. So a lot of physicians have sought, training opportunities at Georgetown, and a lot of our alumni have gone on to become leaders in the field across the country and even overseas. So there's no place in the world where you go and you say, I'm from Georgetown. Somebody will say, I've been there, I know somebody there, I trained there. So, and being in Washington, D.C., that helped tremendously. So, this is makes us unique. The other, I think, important thing is that we're part of a big healthcare organization, MedStar Health, that is very focused on patient care. It's priority number one. So they're heavily invested in supporting the faculty, supporting the departments, supporting the mission of providing the best care, of improving access to our patients. So all these have allowed us to become leaders in the field, and now, GI across MedStar and at Georgetown is one of the largest GI service lines in not just locally, but I think nationwide. So all this has helped Georgetown become the hub for GI services. And to be the hub, again, it's a great prestige, but that's a lot of pressure. So you have to live up to the expectations, and expectations of being efficient, being accurate, and being up to date. That's it.
That's all very important. Exactly. Thank you so much, Dr. Haddad, for sharing that. Now I want to bring Jeff in. Now that we've heard about the program's evolution and the future of GI care at MedStar Georgetown, let's bring that story to life and introduce Jeff Ferrill. Thanks again for joining us. We're really honored to have you with us. Could you share a bit about your journey and what brought you to MedStar Georgetown's GI program?
Well, first of all, I just want to say thank you very much for including me in this meeting.
Of course.
My journey, quote unquote, started when I had a Nissan fundoplication for a hiatal hernia, and that prompted a critical volvulus in my stomach. I was rushed to the ER, and the team was there, and they said, we got to get this guy in right away, no paperwork or anything. And long story short, the team of Dr. Haddad, Dr. Jackson, Patrick Jackson, and others saved my life. They said I died twice on the table. If it wasn't for Georgetown and their team approach to care, I would not be here talking to you today. And I'm eternally thankful to Dr. Haddad and the team for that.
Almost brought me to tears. Go ahead, Dr. Haddad.
Just there's one thing that Jeff has mentioned is the team approach, and in our world we call it multidisciplinary approach. And for the GI division, GI team to be successful, you cannot be successful without having the right support on the surgical side, on the oncology side, on the radiology side, on the pathology side. So again, and this is the commitment that the institution has shown, supporting all these services that collaborate together and provide a multidisciplinary approach to our patients, ends up being, translates into best care and better results. So, and Jeff's situation was a perfect example. And I recall, and I think Jeff is okay if I share some intimate moments. I mean, the first time we met, he was on the table, and I called Dr. Jackson into the room. When I looked inside his stomach, it was full of blood, and um, very shocking. And what you have to make a decision. What do you do? Major operate surgery is very involved, and he would have been left uh, without any stomach, period. And so having Dr. Jackson there, we talked and we agreed. I said, let's wait, come back 24 hours. And we came back, which was the best decision we ever did. Things have cooled down and we felt we could manage without a major surgical intervention. And that's how the story started. And multiple endoscopies and multiple, instrumentation, stenting inside the stomach. We were able to save Mr. Ferrill's anatomy to a certain extent.
In my life, right, Dr. Haddad?
Oh, well, you helped a little bit. You were quite a team player. You're a fighter, and you refused to give up. Yeah.
Absolutely. Yeah, hearing your story, Jeff, you are quite the fighter, and it's a testament to the care that you received also, and the multidisciplinary approach involving specialists from all kinds of fields and backgrounds. So thank you so much for sharing that. I think you touched a lot of people out there who are listening and watching this Facebook Live with us. Jeff, could you share, how did the care you receive impact your life physically, emotionally, spiritually? How has your life changed?
Well, my journey took 3 years, and actually, I may be a fighter and a team player, but there was one point where I was almost ready to give up. But Dr. Haddad and the team encouraged me, and I said, I'm not going to give up. I'm going to keep fighting. And so I did that. And after 3 years, I wasn't able to really eat, right, Dr. Dodd, for about 3 years. And after multiple stenting and so on and so forth, I can remember when I was able to have that first glass of apple juice, which doesn't seem like much to anybody, and then oatmeal, so on and so forth. And so physically, I was able to gain strength, and I'd lost 50 pounds, and I was able to maintain my weight. Emotionally, now I figure that I have to live every day to the fullest. For example, we just changed time. No one likes this time change, I'm sure. I used to really get depressed, but now every day I open the curtains, whether it's dark or the sun shining, I am thankful and continue to be grateful to Dr. Haddad and the team. Spiritually, I think that I was saved to do good in this world. And so I move forward with great vigor and try to help others and not think about myself as much as I used to.
Quite amazing. Very, very touching words, Jeff. I don't like the time change, I'll say, but I could see how, going through your experience, you're just much more appreciative, and it really helps to put things into perspective. So thank you so much for sharing your story with us. At this time, I want to pause and welcome our viewers again. Thank you so much for taking time to tune in and hear Jeff's story, hear about the GI program from Dr. Haddad, and also hear about the incredible impact that philanthropy is having on gastroenterology care at MedStar Georgetown University Hospital. We have more to talk about, so keep watching, share this Facebook Live with your friends, and if you have any questions, please share those in the comments below. All right, at this time, I want to turn back to Dr. Haddad and talk more about the GI care that is available at MedStar Georgetown. Could you share, what advantages does the Georgetown University partnership bring to patient care, research, and education?
Yeah. Again, we are in a unique position, unique situation where we have ties to the School of Medicine, which provides education, research, development support, access to other people who are doing research in the field or field that is related to GI. At the same time, on the other side, we have hospital leadership, we have our health leadership that is heavily invested in patient care and supporting delivery of care and supporting the type that what we need to provide the best care possible. Going back to Jeff's story, if we were not, we didn't have cutting edge equipment and access to high-end endoscopic accessories, we would not have been able to provide the stenting that's needed. That saved Jeff, saved his life, and saved major interventions, unnecessary interventions down the road. And because we are a hub, we are a teaching center, we carry on clinical trials, whether on the endoscopy side or medical side. We always have access. We are in the know-how. We know what's happening in the field. So before things are available in the market to everybody else, we're aware of it. We've tested it. We trialed it. So ultimately, that benefits our patients. So this is what makes us unique, puts us in a unique position to ultimately benefit our patients, not just at Georgetown, but in the community as a whole. And our expertise is not limited, but we have multiple centers of excellence. One is around pancreaticobiliary diseases. We have a great team, GI, surgery, oncology, radiology, radiation oncology, pathology, and so forth. So we are a premier center and a major referral center for pancreaticobiliary disorders, pancreatic cancer, and so forth. Also, another major center or an area of expertise for us is inflammatory bowel disease. We have a center of excellence around this entity, which is very common and it's getting more and more common. So we have the medical, clinical, GI, surgical expertise. We have all the supporting services situate like infusion, specialty pharmacy, and so forth. We also have a center of excellence around foregut. Foregut meaning esophageal, gastric. We deal with complex hernia repairs, esophageal disorders, motility disorders, and so forth. Again, it's all about a team approach, having a team of experts, and we have multidisciplinary meetings that occur on a regular basis where the experts share cases and give their opinions and ultimately get back to the patient with a recommendation, sort of like a virtual consultation. Okay.
That's amazing. Dr. Haddad, could you also share how will philanthropy directly impact the future of our patients, our trainees, the broader field for expanding and enhancing that GI care?
Yeah. We know we live in a different environment today. I'm talking about research funding has become more and more challenging. So to carry on, research and development and even education and training has become more and more challenging. So we rely on, the clinical revenues, clinical funding, which again is challenging. You hear about reimbursement cuts. So it becomes more challenging. Things get expensive, more expensive, cost you more to run an operation, run a department, but the revenues, the expenses go up, revenues go down. So we try to be as efficient as possible. So any access to capital is limited. So we rely on philanthropy. It becomes a critical component to support our mission. But philanthropy serves as a major reason in our mission. It's very critical, very important, and to make sure we continue in our strategy of improving care, continuing education, research and development funded to provide better and better care to our patients.
That's very important. Thank you so much, Dr. Haddad.
Yeah.
Right now, I want to turn back to Jeff and ask a few more questions. First of all, going back to your story and your experience receiving care at MedStar Georgetown, what would you say to someone who's considering coming to MedStar Georgetown for GI care?
Don't hesitate. Go immediately. No, but seriously, Georgetown GI, I think, is one of the best, if not the premier, GI department, not only in the Washington area, but probably in the country. They deal with some of the most complex situations. Joan, my wife, and I have referred people to Dr. Haddad. And when other doctors had said, and departments had said all was lost, Dr. Haddad and the GI team used the approach that if he can't help them, there's someone in that hospital that can do it. We've referred some of our friends who would not be here were it not for Dr. Haddad and his expertise and the department's expertise and the hospital's expertise. And another thing is that it's a teaching hospital, which gives access to the best students, internists, and residents to help complement the team.
That's wonderful. And you also know firsthand how donor support can make a difference. So if you could speak directly to fellow donors out there, what would you want them to know about the difference that their support can make?
Well, from my personal experience, when I could finally eat and have that first spoonful of oatmeal, Joan and I were riding back from the hospital, and I was thinking, we've got to do something for these people because they have really made an impact on our life. So on my return visit, I went to each of the departments and asked them what we could do. We started out with baby steps, I guess you might say. And it was amazing to me to go back. Sidebar, the Ferrills really do not like notoriety when it comes to giving. They just like to give silently. And but so after we gave the gifts, we went back and we went to each department as a sort of an observer. And it was very heartwarming to see what a small amount of money would do to for the equipment for Dr. Haddad, for some teaching rooms for Dr. Jackson, and that motivated us to give more, and we continue to do so.
And we definitely appreciate your support. We appreciate you guys even, going back in person and seeing the direct impact that your support has made at the hospital. We really appreciate it. And thank you both for your generosity.
If I might belabor the point, other things happened. For instance, we were in the same day waiting room in the old hospital, and we noticed there was not a break room for the staff. So we gently suggested that we would underwrite a break room. And I went back one time when I was in the hospital, and it was rewarding to see how it really impacted the staff. I was also in the ER, the old ER, and I noticed that the staff really had trouble communicating, and that the floor was just not soundproof. So we gently suggested that we would underwrite a little renovation there, and I went back in and just anonymously, and was so happy to see that everybody seemed just a little happier. And that just gives, I don't know if you ever had a warm glow in your heart, but that's what it did for me. And nobody knew that we'd done this. And I encourage others to take baby steps. The hospital, yeah, they like major gifts, but even baby steps helps a lot.
We are eternally grateful. And me personally, this was my first experience with philanthropy. As you know, as physicians, we take care of patients. We rarely focus on philanthropy. In fact, when we get approached, we don't know what to do with it. Mr. Ferrill, after, when he was almost fully recovered, he asked me a question, and he said, "Nadim, what do you like to do?" And so I looked at him, and he was coming out of recovering after an endoscopy. I said, maybe he's still sleepy. And so I didn't know what to say. I said, he said, "What do you like to do?" I thought he was asking about my hobbies. So I said, "I like to ride motorcycles." He said, "No, no. Now that you have become the chief, is there anything that you're interested in?" And then it dawned on me. I said, "By the way, I am very interested in quality improvement," and I had appointed one of the faculty members who's focused on quality to be the quality improvement officer for the department. And the Ferrills, were generous and gave us a small donation, and which we used appropriately, and came back months later, and we shared with them where the money was spent, and how important it was, and the results achieved from the implementation of some quality improvement initiatives. The whole department was there, and they were very, very grateful. And that's how things started. So me personally, and the whole department are eternally grateful. And we couldn't have done it without the Ferrills. And fast forward, to this major project that we're embarking on. Without the Ferrills' gift and commitment, it would have taken a lot longer to achieve.
Incredible. That's incredible. Thank you so much to both of you for sharing your experience. Dr. Haddad, if you could share one message to donors about why their support matters so much right now, what would you say?
It's more needed than ever now in the environment we live in. And we have the faculty with the expertise, that have the commitment, who are heavily invested in continuing to advance science, GI, medicine, and provide the best care possible. What we need is the proper environment and the support to continue in that mission. So this is the time, even a small donation can make a major, major impact.
Thank you so much for that. And looking ahead, let's say 5 to 10 years ahead, what do you hope to say about the impact of philanthropy that it's making on GI care at MedStar Georgetown and everywhere across MedStar Health?
I want people to look back and see where we were and where we have gotten, after 5 years down the road, or 10 years down the road. Expansion definitely is needed to continue to grow and expand the field, expand the care, make more options available to our patients, provide more cures, more diagnostic tools, more interventional tools to provide a variety of therapies in an environment that is relaxing, welcoming, warm, that alleviates fear, make patients not as scared coming to see the doctors. So this is really what I would like to be able to look back and think about.
Thank you so much. I want to close with any final words from you, Jeff, as well. Anything that you want to share with our audience before we wrap up today?
Well, I think that from my experience, at first we were reluctant to give because I especially, and Joan, we don't like the notoriety, but we felt a real need to give back. And we were overwhelmed by the difference even a small gift could make to the hospital. And given the cuts in funding and everything, anything one could give is very important. And Dr. Haddad referred to the plans for the new endoscopy suites and GI center. It's crucial that this facility be built as soon as possible. And some funding has happened, but more, and as Dr. Haddad said, even a small amount would be beneficial. From the R&D side, that's critical to his department and the hospital. And I would encourage people to, if they feel so inclined, to do what they can. You don't have to really go for a lot of money. You can give whatever you want if you feel so inclined. I was a little nervous because when I started this, hospitals don't need money, but then I realized, we just did it because we wanted to give back, and we're blessed to be able to do it, and believe that from whom much is given, much is expected. But then, as I got into it, I realized that extra funding from gifts is crucial to the survival of the GI program, the surgery program, and it's very important.
Absolutely.
Very important, even small amounts to help us expand on the new frontiers. Areas that are not well established yet, and you want to do a little investment and test the water, as they say. That's where small seed money becomes critical, and also it gives the opportunity for patients to express their appreciation, how grateful they are, and if they have a passion for one area versus another. I know some patients are interested in cancer treatment and cancer diagnosis. So we have areas for that rhyme and resonate with everybody, and could use the support to keep them moving forward.
Thank you so much for sharing, Jeff. Thanks for sharing your story, and both of you, thank you for sharing how much the act of giving your gift for advancing patient care can make such a huge impact in patients' lives every day. So we really appreciate that. I want to give a heartfelt thank you to both of you for taking the time out to speak with us. It really means a lot. It really touched my heart, and I hope it touched everyone's heart out there who's watching and tuning in to us today. If you're wondering how to help, know that your support truly can make a difference. Together, we can shape the future of GI care at MedStar Georgetown. To learn more or make a gift, visit the link in the comments below. Thanks again for taking the time, and hope you all have a great day.
Thank you, Michelle. Thank you for the opportunity.